A lot of things took a pause during the pandemic, including enrollment of kids in child care services. So that meant more parents were left balancing work and caretaking responsibilities while also navigating economic uncertainty. And now as child care centers reopen, some families appear slow to enroll their kids. Joining us to discuss how child care and youth programs have been impacted are Sonia Crum-Knight, Vice President of Programs and Impact at Carol Robertson Center for Learning, and that serves communities across Chicago with 2 locations on the west side, and April Janney, President and CEO of Illinois Action for Children. Welcome both of you to Chicago tonight.
Thank you.
You're welcome. First with you, April. Just tell us how the child care industry has been impacted over the last year as a result of the COVID-19 pandemic.
Well, we know initially that a number of child care providers had to close because of the shutdown period, and except for those that were serving essential workers, that we had to work to get them open and being able to serve essential workers, basically, who had to go to work. Impact overall was with attendance and enrollment decreasing, overall loss of employment for those parents who had to leave work, and for child care providers who had staff who had to leave. And so the overall employment loss. But then being at home for those parents who could work from home, having to juggle parenting, teaching, and working remotely became a big challenge, and keeping that income coming into their homes.
So a big impact on families and also on workers at child care centers. Sonia, how were the communities that you serve impacted, both the families and then the workers?
Yes, well, COVID exposed existing vulnerabilities and historic systemic inequities, right? So our staff are part and parcel of the communities we serve. They come from those communities, so they were deeply impacted, as were our families. Our families, though, are the essential workforce. So we started thinking about reopening as soon as we closed. And we were sure to curate the most recent research from the CDC and guidance from the Chicago Department of Public Health and the Illinois Department of Public Health to make a plan for reopening safely. Throughout the pandemic, I think it's important to note that we kept our employees whole. We immediately switched to a virtual framework for service to our children and families because we needed to maintain some level of service to a community that depends on us to be there every day. So in addition to virtual spaces for connecting, we also did a Monday distribution of essential materials, supplies, as well as learning materials.
So a lot of your families, essential workers that can't exactly work from home and take care of their children, they have to go to their jobs. So those virtual programs, I'm sure, came in handy. April, as we mentioned at the top, things are reopening, but you're not necessarily seeing a lot of families and kids come back in. Is that correct?
Yes, I think in some cases a lot of parents are nervous about health concerns with exposing their children, and those children coming back to their households and maybe exposing them and people that they have to care for in their homes. But also teachers are as concerned about their health and the exposure that may have on their families as well. So there's that nervousness, that tension about keeping everyone safe, as Sonia said.
And Sonia, you know, a significant portion of the workers in this industry are women, are black and brown. Are they able to come back to their jobs? And are there enough candidates to meet the demand of jobs in this industry? Because we hear there might be a skills gap out there.
Yes, well, the Carol Robertson Center for Learning has a long legacy of growing our own. So we are always actively recruiting those that may be interested in a career in early learning and youth development, and we work closely with them to build those skills and get the requisite education and state credentials. And we took good care of our employees. I think that it's really important to stay grounded in the science, to be transparent and foster two-way communication, and to lead with dignity, right? We listen to the fears, we listen to the concerns of both our parents and our staff, and that was really important for us.
And April Janney, you know, as you know, President Biden has proposed big-time federal funding for child care relief for families. How might that impact families here in Chicago and families that your organization serve?
I think for families, it helped them to cover the cost of child care that they need and being able to find places where they could pay for that, as well as with the child care providers being able to not have to receive these interruption grants so that they can have and bring staff back to capacity and sustain the requirements to meet the PPE and the additional cleaning, along with their fixed costs. Because right now, well, maybe soon, but right now they're not operating at full capacity. So you have a limited number of kids who can be in the space, which means that they're not getting their full income from the slots that they could fill.
And Sonia, as we know, in the latest federal relief bill, families got $1,400 checks or more if they had kids. Have you seen that go toward child care costs?
Well, I can't really speak to, those that much needed support going to childcare costs, but I would imagine for our essential worker families who receive the state-funded childcare assistance program, which also requires a copay, if you will, a small percentage based on income that they have to pay. I would imagine that that infusion of much-needed resources definitely helped to cover that.
All right, well, we'll have to leave it there. Our thanks to Sonia Krumnight and April Janney. Thanks so much for joining us.
Thank you.
Thank you.